The main complication of atrial fibrillation or AF is an increased risk of having a stroke. People with AF are 5 times more likely to have a stroke than without AF. This risk can vary and depends on several factors. There are medicines available to help prevent clot forming, and this is usually advised for people at risk of having a stroke with AF. These medicines are called anticoagulants, the most common of them being warfarin. There are also newer anticoagulants called the NOACs. They can all help reduce your risk of stroke by up to 2/3. The risk of having a stroke can be calculated using specific questions based on a scoring tool. This scoring tool is called the Chad-Vasc score, and your doctor will score points for each question that applies to you. This will then help decide if you're at an increased risk and need treatment. As with all treatments, there is a small risk if you decide to take anticoagulants. The main risk is that bleeding problems may occur, and this is because the blood doesn't clot so well. Other treatment options involved with atrial fibrillation include rate control. This means bringing the heart rate back down to normal. This is done for all people who are known to have AF with a fast heart rate. There is also rhythm control. This means converting the irregular rhythm back into a normal regular rhythm, and this is usually only possible in some cases. Aspirin is now no longer recommended for the treatment of stroke prevention in patients with AF. This is because it's been found to be ineffective. There is also an operation called left atrial appendage occlusion, and this can also be used to reduce the risk of stroke in people with AF. All these options can be discussed in more detail with your doctor. If you have any more questions or any concerns, please feel free to make an appointment to discuss this.